Happy to see you. I remain Dr. Clement Edobo, the one who is interested in your health. Thanks for always watching us again and again and again. Today, we are still on coronavirus, but this time we are relating it to a special group of people. Who are these great people? They are our mothers or expectant mothers. They are mothers that have great children, that are kings, that are governors. They are just anything. Only you, because you are special, can make all these things possible. But today, how do we relate this to our mothers and our wives? Yes, how does coronavirus affect pregnancy? When a mother or a lady is pregnant, can the baby have coronavirus? Does coronavirus, is it more severe in pregnant women? We agree that pregnancy itself is stressful enough for these women. And now the issue of illness had to be added. Will it make them more sick? Well, there are no evidence to prove that when a woman is pregnant, that the effect of coronavirus is more severe or they become even more ill compared to an individual who is not pregnant. And that is good news, of course. There are no evidences to show that a woman that is breastfeeding can transmit coronavirus to the child who is suckling on the breast. That is also another very good news. There is no evidence that this coronavirus can cross the placenta to the baby. Now, a study that has been done, not in Nigeria, of course, we've not done any study, but in the US and some other countries, they found out that there are no evidence of coronavirus when cord samples were collected from children whose mother were exposed to coronavirus or whose mother had coronavirus. They all had good results. The babies were doing fine, the mothers were also doing fine. We do not currently have a data to show whether mothers actually died from such event and if it is because of the coronavirus or other complications from the data we have so far. So the good news is that mothers, with your pregnancy, you need not to be afraid whether the baby will get that virus intrauterine while still in your tummy, generally speaking. So you are safe, but you are expected to practice good hygiene because when the baby comes out and you have that virus, you can actually transmit to the baby when the baby is not out. So you still need the universal precaution to be able to prevent your loved ones, such as your baby, from getting it. But there are also studies to show that in early pregnancies, certain women who had coronavirus had miscarriages or abortions. So if possible, let us avoid being infected by this coronavirus. If your wife is pregnant, please be careful so that you do not bring this deadly disease to your loved ones, your children, or your wife. So you can breastfeed. If a woman is exposed to coronavirus, the baby is not going to have it from breast milk. So you can live your life the way you should. You should be hygienic in all you do, just as you will be for other diseases, not just for coronavirus. However, there are studies to show that if a child or a baby eventually have coronavirus, it can be very severe, especially when it leads to pneumonia. And because pneumonia in that age group is difficult to manage. Therefore, it is good news generally to know that our mothers, though they are not spared from the disease, but they do not have a different way they react to it because they also have an immune system. And that is the good news, and that's I'm happy to say so. This disease is not meant for you, it's meant for everybody, and we know that in due time, we are going to have a vaccine that will be able to prevent coronavirus. I'm sure our mothers are very happy to hear this because I am happy I came from a mother. And you fathers that are watching us here, you also know that you came from a mother. So let's respect them for who they are and let's treat them with a measure of respect. Till our next episode, remain safe, wear your face mask, wash your hands, and watch Moment with Doctor on your channel.